Next up, I'm delighted to welcome Dr. Anne Cody, who is Head of Pre-Award in the Health Research Board Ireland, and Dr. Laura O Philbin, who is ASI's Research Officer. Laura also facilitates and supports the members of the Dementia Research Advisory Team. So they're going to give us a little oversight into PPI in funding applications and some of the common pitfalls therein.
Hi, good morning, Anne, and I'd just like to say thank you so much for joining us today, and to everyone, thank you so much for joining us today. I think we can agree that our PPI contributors and our collaborators have so much to give and so much to add, and have started a really great conversation. So Anne, I will jump straight in because I know our time is limited. So we know that the HRB is really supportive of PPI. You know, you funded the PPI Ignite projects, and PPI contributors make direct decisions to funding, and in the HRB's 2025 strategy, the public will again be at the heart of the HRB funding decisions. Do you know yet what this might look like or how it might be?
Yeah, I mean, this is a fabulous event. I'm delighted that you asked me to come today, because it's a really important step to have this group together and provide input, and not just input, but shape the way that dementia research is done. The HRB is, well, we're very much in the final stages of crafting our strategy for starting in 2021. And yes, PPI is definitely featuring within that. At least this time we have a slightly better idea of what we're going to do about it than the first time around, when we were just beginning to figure out our own way. We are very much, in terms of external support for PPI in universities and for researchers, we're very much looking to build on the fabulous work that the PPI Ignite Awards have done and are continuing to do at this point. We hope to move on to a national PPI network that will support a number of institutions, so 7 universities very directly, but also have benefits for the much broader community. And we do hope to move towards that in kind of following on from the PPI Ignite Awards. We certainly will continue to have public reviewers on our awards. You may know that at the beginning, we used the public reviewers' comments very much as feedback for researchers, because just like was mentioned before, you know, researchers at the beginning were quite anxious, I think, about how we might use this, and being judged on something that many researchers didn't know a whole lot about. So we felt it was quite important to give researchers also an opportunity to learn about how to do PPI and how to do it well, rather than box ticking, which is a completely pointless exercise from our perspective. So we started off by trying to build capacity and get people more familiar with the idea and with the practice through both supporting them, but also you know, giving feedback. We have now moved since the beginning of this year into incorporating the public reviews into the selection process for our awards, and we also will have more and more PPI panel members on selection committees.
That's brilliant, Anne, and I think definitely from our perspective you can see how much even the PPI Ignite Awards have made such a huge impact within the community, on charities, on researchers, on institutions as a whole. So the fact that it's continuing and growing is even more exciting, you know, and it can be accessible to even more researchers. So I just wanted to move on to, we're kind of seeing now an increase in researchers coming to us when they're starting to just think about their application, and maybe they'll put something in, which is brilliant. And from the perspective of the HRB, what do you think is the benefit of having a PPI contributor involved when you're actually writing your application for funding?
Well, that's what we're really hoping for, that we have that relationship forming before pen is ever put to paper and an application. Because the first question is sort of, is that research idea that a researcher might have had, is that even relevant? Does that even, is that phrased in the right way? It might be relevant, but not capturing the right outputs. It might be, you know, there might just be things that are, you know, that might be of academic interest, but that are not lending themselves to making a difference to the lives of people in that group. So, you know, ultimately the HIB wants to fund research that makes a difference to the health and well-being of people. So, you know, the best way of making sure that happens is to include PPI and have a thorough discussion as to the research question for starters, but then also obviously throughout the conduct of research. Is this feasible? Are we asking reasonable things? You know, are we asking for the right outcome measures? Are people able to contribute to the way that you want them to contribute? You know, can this be done properly? And that includes both the writing of an application and of a plan, but also the ongoing engagement throughout. It depends a bit on the nature of the research. If it's lab research, you know, the PPI input in methodology is going to be a lot less than if it's around working with participants.
Okay, brilliant. And that's actually really good advice, you know, to make sure that you speak to people before you even think about putting pen to paper. And for any of our researchers tuning in today, what other advice would you give in relation to PPI and a funding application? You know, what really impresses reviewers in relation to PPI?
And I have to say, it's not just the public reviewers who look out for good PPI. It's actually a lot of the scientific reviewers look out for that as well, and see it as a mark of quality. In particular, if you're doing something that would very much involve, you know, delivering a service, a product, a treatment, you know, whatever it happens to be, a care pathway, you know, that impacts on a particular group of people. It is a mark of quality to ensure with that group of people that this is something that would work and that would be beneficial. So don't underestimate the impact, even though it's not as a distinct scoring criterion. Don't underestimate the impact that good PPI can make on the success chances of an application.
Yeah, I think that's a really good point. You know, the PPI, it does permeate through the whole application, and it's not just about the PPI section. It actually boosts all of it, you know, as a whole. And
budget, then actually, budget, include a budget. if you say that, you know, you want to do all these wonderful things and, you know, engage with your PPI members in a broad way, and, you know, that might cost money to, even for room rental, for catering, for travel expenses, for reimbursement. If you're asking people to, you know, give up a significant chunk of time, there might be all sorts of costs associated with that, and do a budget for them.
That's a great point, Anne, definitely. And then just turning to maybe pitfalls or mistakes in PPI applications, I'd be really interested to know, you know, what should researchers watch out for, you know, when they're putting PPI in? And maybe it's just as you said, they're saying that they'll do all this stuff, but then there's actually no budget for it. Is there anything else that you can think of or that springs to mind?
I suppose the pitfall is to see it as one section in a lengthy application form that you just need to fill in, and, you know, as a hoop to jump through. If you see it that way, it does come across, and it's quite easy to spot. And that means in turn that you're not, you know, you haven't thought through all the benefits that you could get. It's, yeah, I suppose in terms of being aware of, I suppose, yeah, an important question would be to think through of what it is that you as a researcher putting in an application might, what you want in terms of PPI. How are you going to identify PPI contributors if they aren't already named on your application form? And, you know, how is that, what are your expectations, and are they realistic, and have you started a dialogue or not? If you haven't started a dialogue, but say that there'll be extensive involvement later, it just doesn't look all that convincing.